When a cancer survivor comes in, we talk a lot about their function. I just ask them about their day. What do you do during your day? What are you having trouble with? Well, let's see if we can work on that. And so through their functional limitations, I can help determine what their impairments are and how we can address those to help improve what they're limited in, be it pain, range of motion, dressing, they're getting their independence back, just overall quality of life. It's kind of a joint effort that we communicate with the patient to see what their goals are, what they look to get out, and then we both work towards those goals. The exercises we like to work with is a mix. We try to keep it well-rounded, get some of the aerobic to help with cardiovascular function, as well as resistive training to help with the bone density, because some of the chemotherapy agents can help decrease bone density. A big one is peripheral neuropathy, and that's just some decreased sensation, and sometimes it's painful in the feet, and so they don't want to walk. So we work a lot with desensitization, with trying to help their feet interpret normal sensations as opposed to right then they're interpreting as painful sensation, and just trying to kind of rewire the brain. And we do a lot of balance and gait training and just having them up on their feet in controlled amounts to their tolerance. With lymphedema, we take measurements to see what the difference is between the two limbs. If it's a significant change that they can't go directly into a garment, then we have to do compression wraps with it, where we do manual lymph drainage, where we go through and help a real light massage to stimulate the lymphatic system to help the other lymph nodes try to make up for the ones that have been removed. There's usually 3 to 4 days a week for 4 to 6 weeks, and then after we do compression Garmin wrappings after each massage treatment. They wear those day in, day out. They come in, get them changed out, and then we also give them gentle range of motion exercises to work the muscles while they're wrapped to help reduce the swelling. So other reasons that people come to physical therapy after cancer treatment is due to shoulder pathologies. They'll either have shoulder pain, they have posture changes due to radiation treatment with tissue changes, they'll get impingement and other very common orthopedic problems that we see in the general population. These have just been brought on more by either the radiation or the chemo, or just the surgical changes due to removal of the tumors. We do a lot of manual therapy for treatment of the shoulders, range of motion. We show them exercises to work on at home. Sometimes we do soft tissue work to help lengthen the muscles with flexibility exercises. It is never too late to come in and get physical therapy for these issues. A lot of impairments can be addressed 10, 15 years down the road. It will definitely take longer to bounce back from after that if it's not done acutely, but there's still lots of room for improvement and ways to improve your quality of life. I see a significant improvement in my patient population as far as range of motion, overall attitude. A lot of times they'll come in like, I'm only here because my doctor sent me. And then after you talk to them and you find out, well, I can help you with that. You're having trouble getting dressed, there's no reason, we can work with that. For the patient to be able to get their independence back is huge, to where they can dress themselves or drive or do something that they don't have to be dependent on someone else.